Hello and welcome. My name is Carol Antiquera, a PA in the Division of Gastroenterology at the University of Miami in South Florida. In my last video, we discussed all the screening modalities for colorectal cancer screening and recommended frequency to best inform our patient and help them choose the best option for them. In this video, we'll discuss what's standing in our way and how to overcome these barriers. In a study that was conducted of almost 500 age-eligible patients in federally qualified health centers revealed that only about 46% of patients were up to date on their screening. This means there's a lot of room for improvement. In the never screened population, lack of provider recommendation was the #1 barrier. Other barriers included fear, finances, logistics, discomfort, or disgust with the procedure or prep. By having meaningful discussion with our patients about any perceived fears or barriers, we can help them address and overcome many of these barriers. We as PAs are well positioned to recommend colorectal cancer screening for all of our patients starting at age 45 and also to help them stay on schedule with their chosen tests. This is especially true in the primary care setting and can also be true in other specialty areas such as OBGYN during a woman's annual exam or also in urology. While it can be helpful to share pamphlets with patients, we know that direct patient-clinician counseling and interaction really results in a much higher screening rate. Our patients really appreciate the interaction that they have with us, and they trust us to guide them. The quality of the conversation matters. Patients who have encouragement and good quality conversation with their provider will have much higher odds of completing necessary screening than those patients that don't have any encouragement at all. In my practice, when I inform patients that it's time for their colorectal cancer screening, I start the conversation by asking them, what do they know about colorectal cancer screening, or what do they know about colorectal cancer at all? And this really helps me to open up the conversation and understand what the patient already knows or what they don't know. It also helps me to guide them and explain to them exactly what all of the testing modalities are and what the options are for them. By asking my patients these questions, it really helps me to identify what barriers they have or what barriers they think they have to colorectal cancer screening. For example, if the patient says that they have fear, well, I try to explain to them what options are available, what they mean, and how we would go about them. I also ask them after we finish if they still have fear. And many of the times patients say no because they fear the unknown or what they don't understand. And really, it's our job to help them break these barriers. Some patients will also tell me that they have financial barriers. So we work with them and we try to find a test that may be less expensive or in something that they can afford. Some patients will also tell me that they're afraid of anesthesia or that they've had an issue with anesthesia in the past. And so we really try to work with our patients to help them choose the best test and the most appropriate test for them. Recommending colorectal cancer screening via a letter sent by mail to a patient's home can also be very helpful in reminding patients that they're due for their colorectal cancer screening, and this will also prompt patients to schedule an appointment. In our practice, we discuss screening during the clinic visit with the patients, but we also send reminders via text message, email, and letters to the patient's home to remind them of their next upcoming screening date. Some of these barriers are systemic and require our advocacy. But by expanding our knowledge, awareness, and confidence, we can decrease many barriers for colon cancer screening. We really have to be the voice for our patients. We need to make sure that starting at age 45, we're recommending the screening, we're helping them break through any barriers that they may have, whether they be financial, fear, lack of knowledge. We are here. We are the educated ones, and we really need to be the voice for our patients. Thank you for joining me in this video series. I look forward to seeing the impact that we can make together on increasing colorectal cancer screening.